mute. I hear a little bit of feedback already. I want to make sure that we keep everybody muted just to, again, cut down on background noise, cut down on any feedback, make sure everybody can hear. There's a lot of information. It's going to go back and forth this afternoon. So if everyone can hear, that makes it good for everybody. Again, my name is Michael Brower. I am an attorney with Disability Rights New Jersey. I'm going to be your host for the afternoon. I'm very glad that you all could join us. This is our fourth New Jersey Developmental Disabilities Network virtual town hall. It's a great way for us to all convene this community when we can't be physically together. I'm going to go through a couple of ground rules, just kind of lay out some things for you all to expect. Again, you're all muted. I'm going to repeat that a couple times. Just make sure you keep yourself on mute unless you're speaking as part of the presentation, and keep your camera off. That helps cut down on lag. That's me. I'm also up on your screen. I think I'm on your screen anyway. Supervising attorney for the community inclusion team. If you've worked with the community inclusion team, you've probably talked with me at some point or the other. I'll be kind of just steering the boat as we go through here and helping to make sure everything runs as smooth as it can. I want to do a quick plug before we get into the substance of the town hall. Disability Rights New Jersey put up, since the beginning of the pandemic, a dedicated website. It's up on the screen now. That's drnj-covid.org. And on that website, we have links to valuable resources, frequently asked questions, links to our upcoming events like this town hall. And also when we do any kind of online event like this, we try to record and make the slides available on this website so that anybody who couldn't participate live can go back after the fact and catch up on any information they might have missed. It's fantastic, again, chock full of information. I would recommend you take a look. Even if you don't have something specific you're looking for, you might find something there that you didn't know you needed. I want to welcome, we have a special guest this afternoon, Assistant Commissioner Molly Green from the Children's System of Care within the Department of Children's and Families. You're going to hear from her in just a second, but we're really excited to have her with us. It'll be a good chunk of information that we haven't covered in any of the other town halls, and we've had a lot of questions relating to the Children's System of Care and how things have changed during the pandemic. So we're looking forward to hearing from her in just a few minutes. Also joining us on the call, Mercedes Witowski, Executive Director for the New Jersey Council on Developmental Disabilities, one of our DD partners. Deborah Spitalnik from the Boggs Center Developmental Disabilities at Rutgers, also joining us here in the call. And when we get to the question and answer, you may hear from her. We have special guests from the ombudsman for the individuals with intellectual or developmental disabilities in their family. Both Paul Aronson and Christine Bachter are joining us on the call this afternoon. And from Disability Rights New Jersey, my boss, Gwen Orlowski, Executive Director, also joining us on the call. And I'm going to ask just a little side note to Naomi. If Gwen happens to be in the waiting room, she sent me a text. If you let her back in, that would be fantastic. So we do want to hear from you. Part of the town hall is a two-way conversation. We don't just want to talk at you. We want to make sure that we're responding to questions that you have. There is a chat window. If you look at your Zoom desktop, you'll see there's a toolbar, and on there should be a chat. Any questions you have, you can type into the chat. We'll be keeping a look at that as we go through. And if you have any thoughts or comments, feel free to share those in the chat too. If for some reason the chat is not showing up on your toolbar, there's a little section that has 3 dots. It says more. You can click on that. It'll drop down a little drawer and you'll see the chat there. And again, just put any questions you have during the town hall into the chat. That way we can take a look and get to those in the Q&A session. If you are on the phone, we know we have a couple of participants joining us by phone. Unfortunately, we don't have a way, because of the volume of people we have in the town hall, to unmute phones. It just creates a little bit of cacophony of sound. The best way to contribute a question by phone is to go to questions@drnj.org. You can send an email to that address. I'll be keeping an eye on that as we go. And any questions that come in, I'll be able to audio speak into the guests and pose those to the panel for anyone that wants to try to provide information or answer those questions if we can. Again, that's questions@drnj.org. Tonight, again, because of our special guest, Molly Green, we're going to be focusing on updates from the Department of Children and Families, and specifically the Children's System of Care. So without any further ado, I'm going to pass off the microphone, mute myself, and turn off my camera. I'll be here in the background. I'm going to pass it off to Assistant Commissioner Molly Green.
So, hi, thank you so much, Michael. I am going to put myself on video. I'm trying to get used to that. And I just want folks to know I'm not sitting on a beach in Mexico, but a photograph that I took several months ago while I was on that trip, which I've been using because kind of lifts my spirits a little bit. And what I was hoping I could do this afternoon with all of you is to give you a bit of an overview of some of the work that we've been doing within CSOC and within DCF to be responsive to the needs of youth and families. And I think maybe some of what I will share will perhaps anticipate or respond to questions, but really to kind of set the context for some of the conversation that I hope we can have today. So my slide deck is very brief. I'm going to ask Michael if you could kind of go to the next slide. Yeah, hi. I guess I want to kind of go back in time to almost 3 months ago when many of us were, within government and within the provider community and in general, really beginning to understand and appreciate the impact that that COVID and our response to the pandemic was going to have a really incredible change in the way in which we operate and do business. And so in keeping with our Commissioner Byers' vision and commitment to making sure that everyone in New Jersey is safe, healthy, and connected, our initial focus was really on ensuring safety for the families that we work with, as well as for our own staff. And so we very rapidly transitioned almost all of the DCF employees to working remotely. Obviously, our child protection and permanency staff teams, as well as a lot of our folks in operations, are still operating, in the field and in the buildings. But we vacated and established ourselves to work remotely, which is no small thing for a government agency that previously did not have a work from home or remote working policy to transition over 5,000 people to working from their homes. And so concurrently with that, we began to look across our service array to quickly identify what kinds of changes we needed to make as quickly as we could, thoughtfully and intentionally, to ensure that services would still be available, that we could deliver them safely, and that we would be able to do this with adherence to the standard of care. And so, as you know, most of the services within the Children's System of Care are also are on the Medicaid platform and are part of the Medicaid state plan or waivered services. And so we worked very closely with our sister division at DHS, Division of Medical Assistance and Health Services, to ensure that we were working as in alignment as possible. And so the first push was to really ensure continuity of in-community services so that they could be delivered through telehealth. And so that framework includes both the telehealth waiver that was affected by Medicaid, which stands through the duration of the emergency. There's no date certain. It's really more tied to event than to a date. And then some additional waivers that were required for our own state regulations to allow us to transition to that remote delivery in the most flexible way that we could possibly offer those services. So this includes not just our intensive in community and our intensive in-home services. It also includes our mobile response and stabilization services. So that was a real challenge in those initial days when we didn't really have a robust supply of PPE. Our providers did not have supply. and we were able to work with a couple of suppliers to provide PPE to our mobile response teams, and also to adjust their dispatch protocol so that they were only dispatching to the community when that was absolutely necessary, and that if they had to do that, they could do that safely and with PPE. One of the things that I think there may be some questions about this as well, and there were at the time, was that we wanted to do a little bit of a deeper dive on individual intensive individual services, or individual support services. We had some questions with both ISS as well as with the ABA and some of the other in-home services that we wanted to ensure that we would be able to offer those through telehealth, and also do that to the appropriate standard of care. And we had feedback from a number of families saying that this was a service that they still found valuable, even if providers were not able to come into the home, that they would be able to have that remote interaction. And so we also included that under the umbrella of what could be delivered using telehealth. So it seemed that once we had our guidance established around mobile and in community services, we were also really looking to put in place our framework around our out-of-home programs. Now, before I talk about that, I do also want to say that during those early days, we got a lot of feedback from providers and from families, kind of like the sense of urgency about getting this protocol out. And I just want everybody to know that we were experiencing that same sense of urgency. What was very important, and I think this was one of the questions I received previously, was very important from the very beginning of the whole of government response to the pandemic, that we be coordinating information and guidance, and particularly around health and safety, and what our expectations were across different types of service providers, to be very consistent. So all of our guidance has been vetted, not just through the department, not just through the division and the department, but also through a team of folks that are working with the governor's office with policy, including attorneys there, to make sure that that we are being consistent across government, that what we are sharing is as current and up to date as possible. So it takes a little bit more time, but we are really trying to be as intentional as we can be about getting information out. So our initial guidance for out-of-home programs was initially issued toward the end of March, early April. And quite frankly, even before we issued the guidance, many providers had already ceased admissions in order to, as part of their efforts to reduce transmission. And I'm not going to go through every point in that out-of-home guidance. I think it's now a 7 or 8 page document. But on the DCF website, if you go to our webpage, on the landing page, there's a box where you can click information about COVID, and that takes you to a page that clearly organizes information for families, for providers, and you'll find the guidance for all of our service array on that page. And when something new is being posted, we label it as new so that you can find it a little bit more easily. And so, a number of the things that we wanted to ensure we addressed in our out-of-home policy was obviously the admission policies, monitoring of staff safety, visitation, and home passes. And so home passes were suspended and continue to be suspended. And in the first 30 days or so, we had also suspended admissions to all but our emergency programs. The visitation face-to-face was suspended, and however, with the caveat that we asked programs wherever possible to provide visitation outdoors, observing appropriate and proper social distancing. We are not requiring that providers do that because we understand that many agencies may not have the physical plant capacity. There may be some staffing concerns, weather conditions, as well as consideration for the safety of individual residents of the programs, that that kind of visitation may be contraindicated. However, the expectation is and has been that families are able to visit and communicate with their families through through telehealth and through video conferencing. We understand that this is not optimal and not the most satisfactory way to communicate with children. And so we are continuing to look at that visitation policy and, assessing and reevaluating where and how we may be able to adapt that policy. The other issue that I think many folks have experienced as a challenge is that we also had to look very closely at our policy around respite. And agency after-school respite is by definition a service that wraps around the school day. And because the schools were closed through the executive order and the nature of that congregate setting for agency after-school, we suspended new authorizations for agency after-school. However, have made it possible for families to transition to agency or self-hire respite so that they can continue to try to secure that benefit. And then summer camp, I think that is something that we've had many comments about and questions. And I can tell you that on a daily basis, we're monitoring what's happening with our camps. We have about 34 agencies that are contracted with us to provide summer camp. As of now, there's about over 60 sites across the state. As of now, about 16 of those camps have already informed us that they are not anticipating operating this year. We have another 50-some sites that have not indicated that they are closing, and we have continued to authorize vouchers for camp. We extended the deadline over a month to allow families more time to apply for those vouchers. And we are really taking our direction at this point from the Department of Health and from the governor's office. Nothing definitive has been announced either way about camp. I will also share, however, that the CDC has published guidelines that support sort of the decision tree for individual camps to make decisions about whether they can or cannot operate safely. We are looking at that, and we're encouraging that our providers look at that as well. And I think some of them have been looking at that in terms of making their decisions about whether they can or cannot operate. And we're monitoring this very closely to see what alternatives there might be available through that voucher program if families are not able to access a camp because they've closed, or because camps are not able to operate safely, or that for some of our children, the camp may be open, but that they may not be able to operate safely for children who require one-on-one support, et cetera. So, the deadline for the vouchers is the end of the week. We anticipate that there'll be some more announcements coming as we get toward the end of the school year. And as soon as we are in a position to provide more more information about camp, we will do that. I'll just pause here because I'm seeing some of the comments, but I'm trying to just sort of stay focused on this, and I'll come back to them. But in terms of the virtual or digital summer camp, we credential the camps for which we can issue a voucher through a request for qualifications. We've qualified camps that offer face-to-face services. There are no standards for virtual camps. We don't have a contract in place for camps that are virtual. We've done some review and exploration of what is out there for guidance for camps that may be transitioning to a virtual platform, and have a lot of questions about the accessibility or availability of that kind of a delivery for many youth. For some youth, it could be really viable, and for others, perhaps not so much. I know one of the questions in advance had to do with, is it possible to, distribute vouchers to families and allow them to be self-directed with those vouchers? And that's a question that we've been asking ourselves internally as well, but I don't have a definitive answer on that at this time. So we can go to, maybe go to the next slide, Michael. Okay. So a couple of things that I want to make sure folks are aware that we are doing is that very early on, we established a daily survey and follow-up process with all of our out-of-home programs, where we are monitoring, it's monitoring and surveillance across the system to understand where we have youth who are positive, symptomatic, or quarantined, where we have staff that are positive or symptomatic, where there are needs for PPE. We've distributed, I think, over 10,000 pieces of PPE to our out-of-home provider agencies. And we also have established a number of alternate sites in the event that we have a residential program that is not able to sustain staffing for a program site. We have an emergency alternative. We have a couple of different configurations of space, one very large space available at the Katzenbach School, where we're temporarily using their dorms, as well as a couple of smaller community-based programs. We're also working with our partners across the departments on a proposal and implementation for what the testing protocols might look like. You know, in a very different situation than DDD, in that our provider agencies are not state entities, they're private contracted agencies, so we haven't been able to implement the same approach to staff testing that the developmental centers have been able to put in place. But we are working on that now. We already know that many of our out-of-home programs, I mean, they've been monitoring staff very, very rigorously for many months now, but are also, many of them are beginning to implement a rapid test prior to admission. We're having a youth admitted, tested, and then quarantined until that result comes back. And so we are not expecting that there be a one-size-fits-all approach to this, but that there will be greater access to testing over the next few weeks. And when we have more to share about that, you know, we will be sharing that publicly. Next slide. So that's kind of an overview, very brief, of what some of the different things that we've put in place. I know that there are a lot of questions, and so I would like to maybe kind of open it up, and Michael, if you can maybe start to like field or feed the questions to me, that would be great.
Sure. Great. Thanks, Assistant Commissioner. That's exactly what I'll do. I've got a few that have come in by the chat. I know you've seen some of the messages come through. I would just remind everyone, if you're here on the Zoom with us and you have a question, please feel free to go ahead and type that into the chat box, and I'll try to get through as many of them as we possibly can. If you're on the phone, the best way to submit a question is at questions@drnj.org. I've got that up, and I'll be watching that live in case any come in that way. So one of the questions I received, this was a pre-submitted question, and it was about folks who, or families who receive in-home support for their children, whether there's been any guidance yet for families that discontinued that in-home support, on when it might be safe to resume it, if there's any particular mile markers or roadmap that they should be looking for to decide to resume accepting in-home supports for their child.
So I think that that's a really, really hard question, because I don't think there's a single answer for all children and families. We have been looking to the CDC and to our partners in the Department of Health to review and inform the guidance that we have distributed thus far. We are not going, I do not anticipate that we are going to be issuing very specific guidelines for individual children or specific to these services, but that as the governor's office moves forward with the reopening plan, and there is guidance about what is going to be permissible and what's recommended and what kinds of gatherings are being discouraged, that families are really encouraged to look at their choices in the context of that. And I would add, very importantly, to also consult with their family pediatrician if they have concerns about their individual child or what might be safe for them and for their family. which is, you know, there are many very different issues here. There may be family members who are immunocompromised. Children themselves might be at high risk. And so all of those factors that need to be taken into consideration. I think there are some particular challenges. I know I've talked about this with a few of you over the last few weeks about, simply the challenge that's introduced by having folks communicating with masks on their faces. Children, don't necessarily tolerate those masks well. It can be a barrier to communication. So that's one of the things that has to be taken into consideration. But we won't be issuing guidelines other than what is recommended by the CDC and by the Department of Health. And I think that and there's a wealth of information on the state's COVID hub site about what the precautions are. And as that's being adapted and updated, it's important for all of us to continue to stay abreast of that, but really encourage folks to consult with their healthcare providers about what's going to be safe for their child.
Great, thank you. And I've got another question here. This is something, we had a few of these submitted and I tried to boil them down to one, and hopefully I captured the spirit of everybody's question. It was a question about how the department informs families about early intervention referral processes for very young children, infants and toddlers with developmental disabilities, and whether there's been any trends in the numbers of folks who get that referral, and then how long children stay in the early intervention program.
So early intervention services are under the purview of the Department of Health, as I think most folks are aware. We have I can't say over the last few months, it's been a little bit different, but over the last year, CSOC has taken a number of opportunities to strengthen our collaboration and relationship with our partners in DOH around early intervention, as well as special children's health services. We've had a number of meetings with that group and with the care managers there to talk about the transition and the application and transition process. The primary routes of referral to early intervention from the Department of Children and Families are typically through either the Office of Early Intervention, the Office of Family and Community Partnerships, the Division of Family Community Partnerships, and the Office of Early Childhood Services in that division. So our home visitation, programs are often a route of referral to early intervention services. CP&P also is will refer families to EIS, and then but that really is sort of outside of the purview of DCF. And I think there are many children who may be eligible for and receive early intervention services who may or may not be eligible for IDD services through the children's system of care. We did spend some time this year really working with our partners in DOH to clarify the eligibility in the application process. In fact, we have a letter that's going out, if not today, in the next few days, to our partners, just really reinforcing what we're seeing as some of the continuing challenges with the applications and what might be missing. DCF does not have trend data on what's happening with EIS or how many children who maybe were receiving EIS are then transitioning to and receiving services through the children's system of care. We have in the last year tried to take a closer look at what that gap is, particularly for children who are, aging out of EIS, may or may not be eligible for other special education supports before they're entering kindergarten. We do know that we have children who are entering the children's system of care as young as 4 years old. The numbers are small, and we began to develop an approach to seeing how we could expand our work around providing infant mental health through both our mobile response and some of our other service lines. I will tell you that right now that work is on hold because of the situation that we're operating in, but that certainly is not off the table. We are, very invested in making those connections with and encouraging early identification, screening, and engagement so that we're able to connect with and identify children as young, at an earlier age so that we can begin to work with them earlier rather than later on. But I think we still have some things, given what we anticipate for the next 6 to 12 months, we are currently looking at our entire service array and thinking about how we need to align our work a little bit differently as we're working over the next several months in a very different way. So.
Thanks. I'm going to switch gears a little bit and take a question out of the chat. This question came from Susan. It's still half concern, half question. She's concerned that there are too many families needing support, and that when folks call mobile crisis, and I'm assuming she's kind of referring to during the pandemic, that it's very difficult, and you're getting told sometimes there's nothing we can do because out-of-home placements aren't available. I don't know if that's something that's come up and kind of bubbled to your level, if you've heard that issue before. If that's
well, I think, first of all, the calls come to Perform Care, and then Perform Care will triage those calls. The call volume to Perform Care has dropped dramatically, as have the referrals to mobile response and stabilization. And we are very concerned about that. I would be concerned if there were specific instances in which a family was told that there's nothing we can do. If a family is calling Perform Care saying, I want my child to be admitted to out of home today, during the period of time under which admissions were suspended, then I don't know that the answer would have been there's nothing we can do, but it was certainly true that we were not admitting other than under emergency circumstances during a period of several weeks in order to, maintain the health and safety of the children and staff in those programs at that time and to maintain their continuity. So mobile is available to be dispatched through telehealth. And, depending on the circumstances, they can also dispatch into the field. And my goal is to be able to get to the place where we're able to dispatch face-to-face. What we have found, the feedback we've had working with Perform Care and looking at what's happening with the call volume, is that many families are very reluctant to have a stranger come out to their home right now. And so they would rather either do the work telephonically or schedule a remote assessment or something of that nature. We are really concerned about this because, as I'm sure everybody on this call knows, at the same time that the volume is going down, we know that the needs are increasing and escalating. And so we are working right now to look at some strategies that that are available to us to try to promote awareness of the availability and accessibility of mobile response, and when and where that service is available and how it could be more effectively deployed and utilized by families.
That's pretty helpful information. I appreciate that. This is, we got a series of questions that were about funding. And again, I tried to boil those down, and I think I captured the spirit of those questions here. And the general theme was, is the DCF or CSOC considering, or have any decisions been made about making an allowance for family members to be paid to provide replacement supports? Considering, like you just mentioned, a lot of families really don't want to have outside folks coming into their house when they're trying to maintain social distancing. And some folks drew a parallel to the way that DDD relaxed some of their restrictions on families providing services and being able to be compensated.
So we looked at this early on because prior to COVID, there was already a disallowance or about having family members that live with a child were not eligible to serve as to provide respite services. And we looked at this very carefully and determined that we really needed to maintain that policy, in that if you are a caregiver, you cannot be both a caregiver and a provider of respite services. If you're a family member or parent, that, I understand that there are many challenges, but you can't provide respite for yourself, right? The respite service is really to give that caregiver some relief. and that, you know, given the structure of our services, is that it's very different than it is in the adult world, where adults don't have the same legal responsibility to provide care for their children. Having said that, I do want folks to know that we are very, very keenly and acutely aware, and have had and are continuing to have conversations with DOE about the very the fact that children with IDD needs and their families have been very adversely impacted. That the unintended consequences of many of the health, you know, like the policies and practices that have been in place to try to mitigate the effects of the pandemic, there has been a downstream effect, everything from losing the in-school supports and that one-to-one support, the challenges of remote schooling for children who were, in different classrooms when they were in school, and the issue around respite as well. And so, again, I think the first, few weeks and months, we were really very much in sort of crisis response mode. But as we begin to understand what this might look like for the next 6 months or so, we are looking at our service array and places in which we may be able to be flexible to provide more of those supports to families. One of the concerns is that respite providers may not be willing to go into the home. Families may not want that person in the home, or the provider may not be willing to go into the home. So I don't know if that fully answers the question, or if there's a follow-up to that.
No, I think that covers the question. It's mostly seen about, has there been consideration? And it sounds like you guys have really thought about it quite a bit. I'm going to take one of these questions out of line because it's a little off topic, but it's helpful for everybody. I think there's a few questions about special education services. We, the DD Partners, hosted a town hall 2 weeks ago with the Department of Education. We had a few representatives, answered lots of questions there. For anyone who has Department of Education or special education questions, I would highly recommend, if you didn't participate, or if you haven't watched the recording, you can go to our website, drnj-covid.org, and the recording and the slides are available there. If you have any case-specific questions about your child's IEP or special education entitlement, I would encourage you you can also call Disability Rights New Jersey. Our contact information is going to be up on these slides and on our website. You can complete an intake and have somebody take a look at your specific case for advice. With that, I've got one other question. I think it looks like it's going to be well within the realm of CSOC, and hopefully this is not an off the wall. For allegations of abuse and neglect, Assistant Commissioner, the question is, for allegations of abuse and neglect that are perpetrated against older children or younger adults, ages 18 to 21, kind of between the systems of DDD and CSOC traditionally, who's the primary state investigator that those kind of allegations should go to, or that would have investigatory authority? Do you know that?
So the answer is, it really depends on a number of factors. So obviously, if a youth is above the age of 18, the Division in Child Protection and Permanency does not have the authority to investigate. But it really depends on the alleged perpetrator, the age of the alleged victim, whether this is an incident that took place in the community, whether it took place in a facility. And so for example, I'm trying to give you an example of why this can sometimes be a gray area. So for example, we may have a youth who there's an allegation in a facility, and the youth may be over the age of 18, but if it's just a facility that's licensed through DCF, our institutional abuse unit may be, maybe the authority that will go in and do that investigation, because it's of the agents of the facility that is licensed by us. There may be, if it's an instance with a school allegation, it will depend upon the age of, if it's in the school setting, that would typically be IAIU. if it's in the community and it's a youth that is who's and the alleged perpetrators in the community, that would probably go to adult protective services. But I think what we try to do, and this is another thing that SCR will do as well, is, you know, in any instance of an allegation of abuse, we have to always look at, you know, what are the specific allegations or facts in that situation in order to ensure that we've got the right entity or entities involved in that investigation. So for example, if it's one of our contracted agencies, IAIU will take precedence in terms of the investigating the abuse allegation, but it's very likely that once those findings, you know, if there's a finding, that also comes back to CSOC for further consideration in terms of the contract with that agency and further corrective action. So yeah, there are a number of variables to be considered.
And I would add on to that, if anybody is concerned that there's been abuse or neglect against somebody with disabilities, whether that's a child or an adult, and you're not sure what to do and you don't know who to call first, it's, you know, Disability Rights New Jersey is not a first responder, but you could always call our intake line if you've got a specific question, and we can at the bare minimum point you in the right direction. You know, if there's a pending emergency, 911 is the first responders. But if you're confused on, you know, beyond that, what to do, I would recommend, you know, calling Disability Rights New Jersey to get some information isn't a bad idea.
I really appreciate that, because I think it's very difficult, you know, for someone who's not doing this work all day, every day, to know really like where is the right place to go. And I think being able to have that guidance. I will also share that this isn't really so much about reporting an allegation of abuse or neglect, but I can tell you that there have been a number of cases during the pandemic where we've been contacted because a healthcare facility has not been able to figure out really like where do we go to help this individual. And I've been really pleased that they reached out to us, so that we've been able, with a number of, you know, young adults in crisis without a lot of family connection, we've been able to step in and provide CMO, have mobile response get involved. We've had a few situations in which we've been able to provide a safe housing option. So, you know, depending on what the need is, it may be reaching out for support and services. And, you know, it's, you know, a number of emergency rooms have reached out to us, and we've been able to be responsive when the entity that would have, quote, standing as the abuse and neglect investigating authority, not really a situation of abuse and neglect. It's really a situation that's not where that youth is in a really difficult circumstance without support. And we've been able to provide some support and intervention with youth in that circumstance.
Yeah, and you know, in times like this, when everybody is starting from a level of crisis, it's always good to have that extra help and that flexibility. So that's a good thing. There's one more question I have in the chat, and I may open this up, Assistant Commissioner, if it's for you, I'll gladly let you take it. But the question is if there's any essential special needs daycares open for essential workers' children, especially now that I guess the context is, you know, extended school year won't be in person, and that camps are less and less likely to be available.
So I have to say that this was something that was brought to my attention pretty early on. And I want to give a little shout out to Clarence Whitaker, who's on the phone with us right now, is on the call, and his staff. We've had a number of families reach out to DCF with this precise concern. And we've been able, Clarence's team have been able to identify daycare providers that have been able to offer that support to children who otherwise would not be able to access daycare. You know, it's a little tricky because daycares are private contracted entities. We provide the voucher, and we license. DHS provides the voucher, but there aren't specific requirements around, you know, the agencies have their own admission and, you know, eligibility requirements, which I think may have an adverse impact. And so, but we have been able to find providers who are able to offer that daycare. And I can't say, because I don't know yet what this might look like, but I think that as we move into the summer, that this is going to continue to be an issue for parents who are essential workers, parents who are working at home, big parents in general, and that we are continuing to look at what other kinds of supports we may be able to make available. But I would say that if this is a particular concern, that please to try to reach out to us, and we will do what we can to see if we can identify a provider. If a family can't find one through their local child care resource agency, we can try to work with them to do that.
All right, fantastic. That's some good news there. There's a few resources if you're in the Zoom that are getting shared around in the chat. Obviously take a look at those. It looks like some are Ocean County specific. That might be helpful if anyone's looking for resources there. I also just want to put the website and the phone number up on the screen so that this will get caught both in the recording and for folks who are with us live.
And we have been working with Perform Care to build out a more robust family page with resources there as well for families. I also just want to add that another concern we had going into this way of operating was a concern about whether it was going to in any way adversely impact on the eligibility application process. And I'm happy to say that it's not, that we are continuing to stay current with those applications, and that we've been able to transition to telehealth when we've in the case of appeals, so that we're not delaying for that process either.
Okay. I've got one more question that just came into the chat, and I think it actually is a callback to an earlier question I may have overlooked a little bit from Liz. And it's on maybe the topic of eligibility, and it's with MLTSS and CSOC services and how those overlap, and how that might affect eligibility or potentially bar certain children from receiving services. I wonder if you could expand on that at all.
So one of the challenges is that if children are enrolled in MLTSS, their behavioral health benefit is carved into that managed care plan and package. And so there are many CSOC services that child is not eligible for, because the Medicaid platform services that child is not eligible for, because they're carved into the plan over there. I think that there are other services that we may be able to provide outside of the sort of treatment service, but it is really a decision that a family has to make as to which plan, if you will, is going to provide the right fit of services for their child. If there are individuals where children are enrolled in MLTSS, but there's some other service that they're not able to access, I would really ask that we be made aware of those situations and see if we can look at them on an individual basis to see if there's some way that we can, what if anything are we able to wrap around that family that's outside of the Medicaid window, like outside of the Medicaid plan, but we may also have available.
All right, so that's something I think if we have any individual cases, I would echo that same thought. I would love to hear if anyone's got some, if they've run themselves into kind of a procedural bottleneck where they can't access the services their child needs. I would like to hear about that too. The DRNJ intake information, like I said, is on our website and up on these slides.
Okay.
We're coming up on the end of time. From my end, I really want to thank again Assistant Commissioner Green for taking some time out of her very busy schedule to join us. And I want to thank all of you attendees for joining us in this town hall. It doesn't mean anything if you're not all here to participate, to ask questions, to give comments and share resources. That all makes this a much richer experience for everybody and helpful for everybody. I want to ask if you have continuing questions, whether they're follow-ups or suggestions for future guests or future topics. questions@drnj.org is open for these town hall specific questions. And I wanted to also leave some time, Assistant Commissioner, if you had any final thoughts or closing
So,
statements you wanted to make.
so I just, a couple of things. One is I just really want to thank you for inviting me into the conversation. It's great to see a number of colleagues, even though I can't see your faces right now, I can see your names. And hello, Dr. Spitalnik and Gwen, and others that are on the call, as well as our staff within the children's system of care. I do want folks to know that we are up and running and we are operating. I'm kind of amazed at what our team has been able to accomplish working remotely, and that we really recognize that these are very, very challenging times, and that the needs of your children are really uppermost in our thoughts and consideration as we are thinking through some of the really hard questions that we have to answer, and that we are very committed to continuing to partner with the Department of Education, as well as DHS and DOE, and that we do want to know, thank you to Paul. I know he had to drop off the call, but he is really keeping us informed about the issues and concerns that are coming up for families. We're sharing those internally and making sure that we are being responsive where it's possible for us to do that. And so if there are other concerns that we haven't addressed here, please share those with Paul, or either directly with us or through DRNJ. We want to continue to be accessible and available. And as always, if there are individual children's needs that where we can be helpful, please do reach out to us, and we will do the best we can to try to solve the challenge that you're facing.
All right, thank you. And with that, we're going to start to do the wrap-up process here. This session is recorded and was being recorded. We're going to be posting the recording to Disability Rights New Jersey's COVID-specific webpage. It'll be a YouTube link. It's also available through the ATAC New Jersey YouTube channel. If you're already a subscriber, some of our earlier town halls have gone there, along with some really great assistive technology resources. So I'm going to send a link out to any of the registrants today. That way you'll be able to find it if you want to go back and listen, or if you want to share it with friends, family, or colleagues who might also benefit from listening out on the session or flipping through the slides themselves for potentially, phone numbers, emails, things like that. For future sessions, we're still in the works of scheduling our next town hall. Again, I would just ask if you have any questions, comments, requests for a topic, or requests for a guest you'd like to hear from. Questions@drnj.org is still up. I'll be keeping an eye on it now and then, and we use that to help shape the kind of resources that we bring together for these town halls. With that, I'm looking at my clock. We're about 4 minutes before the end of time. And looking at the chat, I don't see any new questions. So with that, I think it's time to end the session. And one final thank you to everybody who's participated today. It's really been great to spend some time and connecting out with the world at large. Thank you again.
Thank you.